So for this video, I'm going to be initiating a peripheral intravenous infusion. My first thing I need to do is check the 6 rights of medication administration. I do have my MAR here, just so you know. And then the 6 rights are right patient, right time, right dose, right route, right drug, right documentation. I am also going to wash my hands before I do the procedure. And then I'm going to check the MAR. I'm going to identify the patient using 2 identifiers, so name and date of birth are the usual ones. And then I'm going to set up my patient in a comfortable position. So I do have my fake arm here. To set up my primary solution, I'm going to open the solution bag. And then I'm going to open my primary set. And this is 1,000 milliliters of normal saline, which is what is normally used. Okay, this is kind of hard to open. Okay, going to undo all the tubing, get it ready, take the cap off my spike, and I want to keep this clean, so don't touch it to anything. And then I'm going to take the cap off of the solution bag and spike the bag for a primary. Make sure it is all the way in, and it is. So I'm going to hang my IV bag at the top, and I want to first make sure my roller clamp is all the way clamped before I hang the bag, so that solution doesn't drip out. I'm going to press the, I don't know if you can see that, fill this up halfway by squeezing it. And then I'm going to prime my solution, and in order to prime it, I'm going to use a garbage so in case it doesn't drip out, but I'm going to take off the cap, have it ready in case I need it, and then I am going to slowly undo the roller clamp, but I don't want to let any medication out, just want to make sure that there's no air in the tubing. So I just primed my IV tubing, and I'm going to place the cap back on. And to set up my patient, since this is all ready to go, to set up my patient for IV administration, I am going to get my patient's arm in a comfortable position, which I have it in, and place a linen pad, and I have a towel underneath for, that's just what I had to use. Now that my patient is in position, I'm going to apply a tourniquet 4 to 6 inches above the selected IV site. I'm going to use, this vein looks good and it rebounds. I'm going to apply this tourniquet, make sure there's a pulse. Okay, so there's a pulse. If there's no pulse, you're going to take the tourniquet off, try again. And then I am going to, since there is a pulse, I'm going to take the tourniquet off. If there's hair at the site, you're going to want to shave the hair off. And then, since I'm going to start the procedure, I'm going to want to put gloves on for cleanliness. So, whoops. I have all my supplies set up. I reapplied the tourniquet, and I'm going to insert the IV using my dominant hand for thumb and pointer finger. And I'm going to clean the site with an alcohol swab first. With my non-dominant hand, pull down on the vein to make sure it's straight, and then insert with the bevel up at a 10 to 30 degree angle. And once you get blood return, which I have, I'm going to not advance the needle and the catheter at the same time. I'm going to just advance the catheter. I'm going to turn these blood things off. Okay, So now that I turned those off, in real life, obviously I'd have this ready to go, but since I was able to just connect this, it's easier this way. So I'm gonna undo the cap, connect the primary tube to the IV. I'm going to clean this site, make sure this goes in the sharps container. Clean this site with a gauze pad. I'm just gonna pretend for measures. I'm gonna grab one actually. So I have a gauze pad. Just going to clean it here. Going to apply the Tegaderm to make sure to hold the IV in place. And all of this tubing all needs to be labeled with the patient's name and everything, because when you document, you're going to need all that information. So you don't want to cover the hub, but you want to cover just the bottom. And when what I didn't do is you want to place your finger and hold really tightly above the tip of the catheter site when you are advancing the catheter, and that's how you get the blood to not come out so fast as you're trying to connect the tubing from the catheter. And so I didn't do that, but I would hold down up here as I'm advancing the catheter, because then otherwise you'll have blood everywhere. So now that I have that Tegaderm on, it is in place, and I'm going to make sure the arm isn't long enough obviously, but I'm going to tape the tubing to the arm, and I'm just going to pretend for measure since it's not long enough. But you want to tape it in a fashion to where if they move, it's not going to get tugged and pulled. You want it to be in a safe position. So there you have it. For this peripheral video, I'm going to show you a chevron. You're going to want to place a gauze pad 2x2 underneath the hub, and then you're going to want to take a little bit longer piece of tape. You don't want to tape down all of it because you still have to have access to the port. So you're going to go underneath and you're going to go around, and then with the other side you're going to go around, and I didn't make that very even, but it should look like that ish. I should have made the tape more even, obviously. And with this procedure, I forgot to add, you want to make sure that you set the drip right. And for the order, I calculated it, and the drip rate should be 28 drops per minute for this one. I also did realize my mistake in not taking off the tourniquet after I got blood return and inserted my catheter. You want to make sure to take that off, otherwise blood's going to start coming out even more and you could lose circulation to the arm. So that's an important step that I missed.